Kinneir Dufort is a product and service design consultancy. Our mission is to design a better world. We've been working in designing products in Bristol for 45 years, so we have a really long history of working in that space. We're really interested in medical devices. My role at KD is to run our digital product design team and that expertise across the business, which represents one of 7 expertise teams spanning engineering, human factors, research, industrial design, software and electronics. So a whole spectrum of expertise that we're working in that context. So I think when you're looking at the replication issue and the differences in scaling between a small number and a large, a lot of it comes back around to how you can look ahead and say, look, we obviously need to have the right rigor in terms of process. If it's a regulated product, we need to look at where we can leverage things that have already been approved, be that parts of a components or be that pieces of software that you might be using with your device. And a lot of the value goes into the investment in going, right, let's get the design really good and make sure we're working with design partners that really understand what design for manufacture means and the difference between a kind of concept render and an actual manufacturable product. I think another really key component in that is bringing in the kind of sustainability mindset, and a lot of how you look at creating more sustainable products at scale is by reducing the number of components, by looking at more sustainable sourcing of those components, and sometimes that can create those opportunities, even for smaller runs, that gives you a bit of upscaling if you need it in the future, but allows you to produce what you need to do at a smaller scale right now. So one example of a low volume hardware product that we've at KD have been working on and worked on in the past is the neurotherapeutics watch, which is it's a kind of a new thing. It's a revolutionary thing. It's a new therapy for people with Tourette's and helps them suppress their tics. So part of the process, what's really interesting about the work on that case is that when you're going to create something that's going to clinical trials, you need to be able to produce a limited number of devices that give a representative output of how the end device might be. So you need to create those things, and we helped manufacture and assemble. We used off-the-shelf components to achieve that for neurotherapeutics, so that they could get devices that they could take into clinical trials. And now beyond that, once they've proven their case, which is fantastic, and they've got regulatory approval to take the product further. So we're now looking at the next iteration of design, which will use a lot of those earlier learnings and some of the same componentry potentially, to build it up into a more consumer-ready product and to scale it in terms of numbers and to look at the broader manufacturing possibilities in terms of customization of it to make it an even better product and deliver more value as it goes into larger scale production. Digital healthcare over the next 5 years has a huge amount of opportunity to add and change people's lives in terms of the value it's delivering and how services are delivered, be that through more connected devices or be that through improving the services that people get on a day-to-day basis. It's the kind of complex ecosystem problem of how do you look at that level and break it down into the individual areas to add value. In terms of Kinneir Dufort's role in that context, we work a huge amount with academics, with startups and with pharma organisations who are looking to pick off some of the key areas of innovation and to create products and services that improve people's lives in those digital circumstances. So I think KD has a bringing together the opportunity space and making it real, making a reality for those different people who are trying to improve people's lives.